There are people embarrassed by all 10 of these questions. Some are embarrassed by a combination of these questions, but there is someone out there that if you choose one of these questions, they are severely embarrassed by it and they don't tell the doctor about it. And they fall into that 45% of y'all who keep lying to us and they want their doctor to somehow paint Picasso with half of the colors. And we can't do that. All right, so there's nothing more embarrassing sitting in the exam room, knowing you got a doctor's appointment, you've been waiting for the doctor's appointment, but the question you are about to ask, you think is so embarrassing, so like, oh my God, frightening, that you're like shaking like to ask it, right? Do you know that 45% of the people like will have admitted that they've lied to their doctor? Imagine someone who's in charge of your healthcare, who again, remember, health, wealth, life. Someone who's essentially in charge of your life, you are lying to them. 45% of y'all say, yes, I've lied to my doctor, right? And a lot of times those lies isn't in a malicious, evil way. It's because you are so embarrassed because of this question. You think it's gonna be so embarrassed. Like, oh, I don't want to be embarrassed. And I tell patients all the time, like I put my finger in people's butts, right? To check for like big prostates and stuff like that. Like you can't say anything embarrassing to me, right? Like, and again, you should never be embarrassed. Again, if you don't get nothing from this show, you should never be embarrassed talking about your health, right? So we're going to talk about 10 of the most common questions that I see like asked to doctors, right? Especially internists, right? In primaries, right? Who that is deemed very embarrassing for the patients, but it's something that if you understand like, hey, your doctor is here for you. Your doctor wants to help you out and they can't help you out until you give them the truth, the whole truth and nothing but the truth. Until you do that, right? Like it's, again, you're just giving me half of the piece of the puzzle and you want me to paint a Picasso. I cannot do that, right? So let's talk about 10 of the most embarrassing questions, quote unquote, embarrassing questions to ask your internist. Number one, why am I so tired even after I have a full night's sleep, right? You'd be surprised how many people won't even like muster up to the point where they say, doc, like I'm sleeping, I think I'm sleeping, or at least I'm going to bed for 6, 7, 8 hours out of the night, and I'm still waking up awfully tired, right? And I don't know what it is, right? It's got me, I'm gonna just keep trucking, I'm gonna keep moving on. And I talked about this in prior episodes where sleep hygiene is one of the least talked about things in the office. And when you don't have good sleep hygiene, there's so many medical underlying issues that could be at play, but more importantly, things that aren't at play, but which will be affected, whether it comes to losing weight, whether it comes to gaining weight, whether it comes to having appropriate medication usage, right? All these things happen if you don't sleep well, right? So a lot of times that is a precursor for us to like, oh, something may be wrong if you're having a full night's sleep and you're still waking up tired in the morning, right? So please stop being embarrassed and ask your doctor. All right, number two. So this is one where I hear a lot. Doc, I haven't had a bowel movement in like 3-5 days, a week sometimes, right? Again, when I hear a week, I'm like, wow, a week? First things first, I always ask, okay, first of all, what is normal? Because there are some people who they got to go to the bathroom every other day, right? Every other day, like clockwork, they got to be using that restroom for that number two. There are others who are every 3 days is pretty much okay. So I always ask, what is your typical routine first before I say, is this a problem or not, right? But again, I talk about giving rectal exams for prostate exams. Like a lot of people don't like talking about their poop to the fact that, again, I don't want to gross no one out. But when is the last time you've actually looked at your poop, right? If I said, hey, what is a normal like look to your poop in terms of color, in terms of shape, would you be able to answer that question? I'll pause. The majority of you can't, right? The majority of you cannot answer that question because you'll take a number two. Before you even look, you're already looking to flush it. You're keeping it moving, right? You don't even want to look at it, right? But again, when we're talking about, again, health, wealth, life, right? It's about your life, right? You got to understand, you got to know what it's like to have a normal poop and what it's like to have an abnormal poop, right? Because again, if you're constipated, right, is there medication changes, right? Is there a dietary change that happened, right? Is something else could possibly happen that could cause a change in your bowel habits, right? So bowel habits is an important question that doesn't get talked about a lot. And I think it's because people don't like talking about their poop. Obviously, they don't like smelling their poop, right? But they don't like looking at their poop. They don't know when the poop is normal. We're not even talking about if, other things happen like in their poop, right? But they don't even want to get to that point, right? So make sure you do not leave your doctor's office and you know that something has changed in your pooping style because your doctor wants to know. All right, number 3, doc, why do I sweat so much even when I'm not doing nothing? I'm a bigger guy, y'all, if y'all can see it. So I can do very minimal activity, right? And I start sweating more than my skinnier friends, right? Who I'll see, they'll be outside the same time as me and they won't have a bead of sweat, right? And so we understand that different body types sweat differently. Different people sweat in different parts than other people, right? But when we start asking that question, like, man, I'm sweating even when I'm not doing nothing. I'm just sitting here, sitting in the classroom, sitting at work, and I'm sweating like crazy, right? Definitely a question your doctor wants to know, right? Because they could be associated, especially, from a hygiene standpoint, you're worried about certain smells, right? From a medical standpoint, there's certain diagnoses that may be at play. There's certain medications that may be causing hormone levels that cause you to sweat more, right? So we just got to know these things, right? So yes, sweating may not be cool. And yes, you may sweat in places you don't want to sweat, but you got to tell your doctor and don't be embarrassed by talking to your doctor about your sweat, because there could be a medical related issue of why you're either sweating a lot when you're not doing nothing or you're not sweating at all. Number 4, doc, is it normal to pee this often, or is it normal to pee this little, or my stream has changed, right? Like something's happening with my pee, right? We talked about a prior question where it was like, all right, my bowels don't look the same. This happened on the other side, right? Hey, my pee doesn't look the same. I'm peeing more, I'm peeing less. And you'd be surprised. One of the things, like when I talk to my patients who haven't seen a doctor in a while, right? And they say, doc, I pee all the time. I'm losing all of this weight and I'm peeing all the time and I'm drinking all of the time. Now, if you're one of my medical related friends, students, or residents who may be watching this channel, you already thinking, wow, is this person having a diabetic issue, right? Because we know with diabetes, right, 3 P's, right? You pee a lot, you drink a lot, right? And you poop a lot. So the 3 P's associated with diabetes, right? So it's one of those things where if, right, like you're telling me some issues associated with your urination, I got to know what's going on, right? Because there could be an issue with the kidneys. There could be issue with hormone related issues. If you're having issues where you're peeing a lot at nighttime, now I'm thinking about the prostate, aka prostate exam may be coming around, right? This is my prostate finger, y'all. Those who are on the podcast, you can't see it. I'm holding up my prostate finger, my prostate checking finger, right? Because that's usually the finger I check for prostate exams, right? So all these things tend to happen and tend to occur, and you shouldn't be embarrassed, right? If you're noticing, and it's all about knowing what your normal is, right? If you notice that, hey, I am off my normal, and this is where a lot of the embarrassing questions come about, is that people will know what their normal is. Something abnormal is happening, right? They don't want to tell no one, but they definitely don't want to tell the doctor, right? Thankfully, they usually have some friend or family member, especially for my guys, who will force them to come to the office, right? And they'll be like, hey, I'm going to be staying outside here. You better tell them everything, or I'm going there and tell them. That's usually the case. If that's not the case, understand that you do not have to be embarrassed, right, when talking about your pee or your poop, right? If you go back to our earlier embarrassing question, right? Because it is important for us to be able to kind of help medically manage for you. Oh, this is a good one, right? Doc, I feel depressed, anxious, but I don't want no medication. What should I do? The amount of people, especially when we think about like my back is hurting, my blood pressure is high, my cholesterol, like there are tangible things we can kind of see, right? That it's a lot easier for the doctor to be like, hey, take this medication. And more importantly, for the patient to say, I'll take said medication, right? When we start thinking about stuff that are kind of mental, right? I'm depressed, I'm anxious, right? I'm more stressed, right? It is so difficult to get patients to just fess up to that. And I might be talking more to my men right here, but again, I don't want to discriminate because it happens on the women's side too, right? It is so difficult for people to accept that like there's some mental health related issues affecting our general body, right? Like that they'll just completely ignore it, completely put it to the back burner until it gets to the point where we can't put it to the back burner and you end up in my office or worse, right? Something happens, you get a heart attack, something happens, right? So being embarrassed about your mental health is one thing, but even worse for them, right? Even worse than that embarrassment, especially in that part, the second part of the question is, I don't want to take a medication. The labeling of it is even embarrassing for them. So they don't even want to take a medication that would label them as depressed, that will label them as anxious, right? They don't even want to do that. But again, no fret, right? Like, again, we will make sure that we come to you guys with non-medicated related remedies first, right? Because that's important, right? We got to know what's causing the stress, what's causing anxiety, what's causing these issues here, right? But like just that label of like, oh my, I may be depressed, I may be anxious, is so embarrassing for a lot of people that it never gets talked about in the doctor's office, right? Again, 45% of y'all are lying to your doctor. That's a crazy number to me. 45% of y'all are lying to your doctor. Why y'all doing that? Don't do that again. Oh, now this is a funny one, right? right, number 6, right? Why does my breath smell bad, regardless of how I brush my teeth, right? So again, a lot of times when it comes to oral hygiene, this is another form of hygiene that doesn't get talked a lot about, especially for those who may not go see a dentist as regularly as they see a regular physician, right? So, you don't really have someone all in your mouth looking around, right? But there are a lot of medical related issues that a lot of times the dentists are the first people to catch, right? Like going back to my diabetes, right? There's a lot of medical related issues, some hormone related issues that it's my dentist who say, hey, like, I think something's going on. Like, have you been diagnosed with this and that? Like, so a lot of times our oral health is important. And a lot of times it manifests in us having sugary smelling breath or, ketone like smelling breath or bad breath in general, right? There's a lot of things that, and again, like how many of you guys are going to your doctor and say, doc, my breath smells bad, right? No, you're stuffing yourself with Listerine and gum here and just try to like cover it all up, but not get to the root of the problem. You need to go to the doctor when you try to get to the root of the problem. Do not be embarrassed talking about your bad breath, because a lot of times there could be a medical problem associated with your bad breath that you're just going to kind of brush it aside. We don't want you guys brushing that off to the side. All right, number 7. This is a good one, right? So this is for my OBs, but especially my primaries who, deal with women's health, right? Again, I say this all the time jokingly. When I was in medical school, right, the first time we had to do, because we had a patient simulation, because you had, do a pap smear. It was the first time that I did it, was the first time the volunteer was volunteering to get pap smears done by medical students. So I can kind of tell you, I started off on the wrong foot, right, as far as my relationship with women's health. And then I became an internist, right, because I said, hey, I have less women's health to do than if I become a family med physician, right? So that's why I went the internist route. I love internal medicine, but like, that's why I went the internist route, right? So, women's health is always a thing, right? But I typically do get a question like, hey, doc, I'm having a lot of yeast infections. Doc, I just got treated for a yeast infection last week. Why is it still occurring, right? And again, this is one of those things where, especially if you have an internist or you haven't seen your OB or you haven't followed with your OB in a while, right? And this is something that just keeps on happening. You want to kind of get to the bottom of making sure that there's no medical related underlying disease associated with like recurrent yeast infection, right? And again, big boy diabetes. Diabetes always seems to come up when we think about like medical related disorders that get put under the wraps, right? And you'd be surprised how many different ways and avenues we go to find out a person is diabetic, right? You'd be surprised, right? But recurrent yeast infection in and of itself. We talked about medication use, right? Immune related issues, right? So there's a lot of different things and layers that can come into play, right? But again, because you're embarrassed to talk about the fact that you have a yeast infection or the fact that you've had multiple yeast infections, right? You don't even get to that point, right? Like you just like, all right, I'm just going to avoid it. I'm just sitting my, whatever, and then keep it moving, right? Don't do that, right? Don't do that. Do not be embarrassed, right? Your doctors are here to help you, whether it's your OB, whether it's your primary internist, family physician, right? You can talk to them, right? Because a lot of times there are medical related problems associated with them yeast infections that you're maybe trying to avoid. Ooh, this is a good one, y'all. Number 8, doctor, I am scared. I got this mole. I think it's cancer. I done went to WebMD. It's cancer, doc. I've had this for years, but it is cancer. First of all, I want to tell you, right? Skin related issues are one of the things that, especially you'd be surprised how often they just kind of get brushed to the side. Like, oh, I've had it for a while. Oh, it's not doing anything to me. Oh, it doesn't bother me, so I'm not going to bother it, right? The amount of people who kind of take that approach with skin related issues, it does scare me. And again, I can tell why it's scary, right? Because you get a wart or a rash or something, right? And you're like, what is this, right? Please don't let it be the C word, right? Because no one wants to talk about the C word, right? And a lot of times it makes you so that you ignore it. I talked about this on a long time episode. One of the worst forms of breast cancer that I've seen as a primary care provider was this patient who hadn't seen a doctor in like decades, right? And this is like the perfect example when we talk about embarrassment, right? I'm just going through my little checklist, right? And then again, I ask my questions like, hey, like repeat what I said. Is there any issues, concern, right? Oh, like, hey, I see you haven't had a mammogram. Are you ready? She's like, yeah, doc. Yeah, I've been having a skin related issue, right? Most people, right, especially doctors who maybe not attentive, would let her brush that off. I said, oh, you've been having some issues with your breast? Tell me more, right? Like instead of me just kind of rubber stamping it and, ordering a mammogram, keep moving. No, tell me more, right? We got some time. I'm pretty good. Tell me more. And then she starts talking about it. She said, yeah, I had some skin issues. And I was like, oh, I said, well, we're here. I said, let me call my assistant. Because I want to see what's going on here. When I tell you this patient, it was almost like a fungating mass coming out of her breast because she had just let it just grow and grow and grow to the point where all she did was put like gauze covers over it so it wouldn't like ruin her dress. Now, of course, I was 2 years out of residency, right? So, I'm not fresh, but I'm not like seasoned like I am now. You can see the gray hair. years. The face I had to keep to myself when I saw that. And I said, how long did you have this? And she was like, I don't know, maybe 4 or 5 years. I'm like, and again, I have to keep a straight face, right? Because if I show that I am scared, then like, how do you think my patient is going to take it? Right. So I said, okay, so I think what we need to do, let me refer you to a breast surgeon. Because by this time, it's not no mammogram talk. It's you need to go see a surgeon and cut that thing out of there. Right. Like that's the conversation I have. Right. So when I talk about like, I think a lot of people think that like, especially when we think about running down some of these embarrassing questions, like, oh, why would it be embarrassed by that? Why would it be embarrassed by that? There are a lot of people embarrassed by questions that you shouldn't be embarrassed by. And when I tell you this lady had it was like almost like a tennis ball size mass coming out of her breast. Right. It had protruded that much, right? And we got it to a surgeon, and like it's had a guy taken out. Thank God. Again, this is the reality, right? We're calling it embarrassing questions, but again, these embarrassing questions could be the difference between life or death because you're ignoring symptoms that you shouldn't be ignoring, right? So again, you got skin-related issues. Could it be cancer? Yes. That's why we need to find out how long you had it. Has there been any changes in size, changes in color, changes in shape? We need to know what's going on here, and then I'm gonna send you to the appropriate people because I'm not a dermatologist. I'm gonna send you to the appropriate people, right? So understand, no embarrassing question, especially when we talk about the skin. Number 9, this is a good one, is, hey, I take a bunch of supplements. Is that okay? Like, that's not dangerous, is it? It could be. It could be, right? And this is one thing I always tell my patients, like when you are forthcoming with what's going on in your health, your doctor has a clear picture to know what's going on. We talked about in prior episodes when we talk about drug and drug interactions and the fact that sometimes your doctors don't tell you about it, but a lot of times your doctors don't tell you about the drug interaction because y'all don't tell them about the supplements y'all are taking, right? Y'all see on TV or y'all watch one of these TikToks and they say you should take beet juice for this and this for that and this for that, and you just start mixing it up, not realizing some of the medications you already take, it will have an interaction if you take it, right? But again, you're not going to blame the person who told you to take beet juice. And again, shout out to the beet juice folks, right? Not shooting at y'all, or ashwagandha or seaweed. Shout out to y'all, right? But again, as a patient, if you're going to take those knowing you have other medication, you got to make sure your doctor is fully aware to make sure that your doctor say, okay, you're taking this may counteract with this, so you want to be careful, right? So understand that there are no embarrassing questions associated with taking supplements. You just have to make sure that, it doesn't interact with something that you're already taking. This is the big one, right? And I'm glad I left this for last, right? Because this gets into a conversation that I think a lot of times patients who kind of fall in this category always feel, right? Is it true that my weight is causing all of my problems? Is it the fact that I'm overweight? That's the reason why I have all of these issues that I'm having? You'd be surprised how many patients are actually embarrassed by asking that, right? And the reason why is that a lot of times they take them being overweight as a personal front. Like, all right, I am the 100% reason to blame for why I'm overweight. And that's usually not the case, right? There are a lot of different factors that are associated with weight gain and being overweight, right? But if I say, hey, your knees hurt, overweight. Hey, your back hurts, overweight. Hey, you got this, your peeing is bad, overweight. Hey, like the skin issue, overweight. Like in their mind, they think everything is blamed on them being overweight. So because I saw this one TikTok and I wanted to comment on it so bad. I didn't though. I was very good. Those who follow me on TikTok know, first of all, you should be following me on TikTok. Just search Dr. Barry Pierre. I'm on TikTok. I typically will respond to videos that kind of come across my feed that sound kind of crazy. And this was this patient who was on there saying, hey, when I go see my doctor is not allowed to talk about my weight at all. Like yes, she was like severely overweight, severely morbidly obese, right? She was. I could just tell she was morbidly obese, severely. But in her mind, she was like, I don't want you blaming my weight on anything going on. So you are not allowed to take my weight. You are not allowed to talk. Now, this is the video. I'm paraphrasing it. If I can find it, I'll throw it in the show links. I'm not sure if I'll be able to find it. You can't talk about my weight. Like my weight is off limits. You are forced to talk about everything else but my weight, right? So that is a person who is severely embarrassed by talking about their weight. I don't want you to be embarrassed by talking about your weight, right? Because again, if you are trying to get it solved and taken care of, right, you got to have conversations. You got to talk about it, right? So you'd be surprised how many people are embarrassed by going to the doctor because they know or they just figure that doctor is going to somehow like weave a way into the conversation that they're overweight, right? And they don't want to talk about them being overweight. So they're like, no, I'm not even going to talk about it. And they go to the extreme like this person. Again, not everyone does that, but it may go to the extreme and say, hey, don't talk about my weight at all. Don't even bring it up. Like it's out of there. Like it's a non-conversation starter. That is how embarrassing embarrassed she was by talking about weight, right? So again, don't think about these 10 questions and thinking that like, oh my God, I can't see how anyone would be embarrassed by these 10 questions. There are people embarrassed by all 10 of these questions. Some are embarrassed by a combination of these questions, but there is someone out there that if you choose one of these questions, they are severely embarrassed by it and they don't tell the doctor about it. And they fall into that 45% of y'all who keep lying to us and they want their doctor to somehow paint Picasso with half of the colors. And we can't do that, right? It's just something we can't do. It's something that needs to be fixed and addressed. And I'm hoping, right, as we continue to, build this doctor-patient relationship with your healthcare provider, that you get to the point where there is no embarrassing questions because there's no embarrassing answers, right? So just like there's no stupid questions, there's no embarrassing questions that you should allow your health to be affected by. That is what it is, right? So again, that's my take. Do not be afraid to ask. Again, you can say this might sound weird and your doctors are going to be like, oh, I got 10 people who've asked me that question, right? Because you'd be surprised. I have had 10 people ask me that question one way or the other. So you are not because that's the thing too. Y'all think that y'all are the only person dealing with this problem. You're not. Thankfully, that's a good thing, right? That you're not the only person dealing with issues with going to the bathroom and peeing and constipation and skin issues. You're not the only person dealing with this or weight issues. You're not the only person dealing with this. So once you know you're not the only person dealing with this, guess what? That burden of being embarrassed by it should go down to zero. And if you got a good doctor and you got a good doctor-patient relationship, there should be no burden when you go to find out like, hey, this question, right, I think is kind of embarrassing. And I hope like you don't embarrass me by like, giving me an answer that I don't like, but I got to ask it anyways, right? Because again, it's not weird. It's not embarrassing. It's your health. And it is what you need to get out of when you go to your doctor's appointment, right? So again, yours truly, Dr. Barry Pierre. I'm going to see you guys next week.